right, I think we are all in. Hello, everyone. I am Brittany Hawthorne from Florida Healthcare Plan's Health Promotion and Wellness Department. We'd like to welcome you to our May webinar, Stress Management 101. But before we start the webinar, I wanted to go over just a few items. Please allow your video to be off during this time and stay muted. If you have any questions, you can put your questions in the chat feature, and you can send them to myself, Brittany Hawthorne, or Carla Cosio. We can answer them and see them. But there will be some available time at the end of the webinar to ask our presenter questions as well. And please ensure that you stay on the webinar for the entire time, because you will be entered into a raffle to win a prize at the end. So without further ado, I'm going to hand over the reins to Miss Heather to talk about stress management.
Well, good afternoon, everyone, and thank you for joining our webinar, Stress Management 101, and I think you probably saw a little aromatherapy. So this is going to be fun. My name is Heather Pepe, and I'm a licensed clinical social worker, clinical director of the Behavioral Health Department, and I have a lot of experience in working with, of course, my patients, but also my colleagues, and how we can function in a high stress environment and what we can do to build a toolkit. So that's kind of what we're going to talk about today. I'll go over a little bit of some definitions, some statistics, and then we'll get down to the fun stuff. So first slide we're going to talk about is, what is stress? Everybody talks about, oh, I'm stressed out, or I had a bad day. A lot of different things. Traffic light can stress you out, being late for work, your children, your family life. All these things do cause, higher levels of stress on certain days. Sometimes we don't know why. But when it becomes unhealthy is when it starts to affect your day-to-day functioning. If you're having different effects from your stress, such as your inability to make it to work on time, or maybe you're a little depressed sometimes. Maybe you start to, yell at the children, or you're frustrated and short with a coworker. These are how stress can affect the ways that we behave. It contributes to different psychological, physiological disorders. It can affect your mental health. It can affect physical health. And it can actually reduce quality of life over time if untreated. And so how do we deal with that? Well, how does America deal with that? There's some slides here where we talk about the pre and post pandemic. For us in our nation and our world, this was one of our biggest events that has occurred recently. So a lot of research is now done globally to determine, how adults and the percentages of how our stress elevated during these times and still after, because I think a lot of us still have maybe some PTSD associated with this big event. If you look 18 to 64, the stress levels are still at a pretty higher percent. And what I noticed was 65 and older, they're handling that stress pretty well. And so why is that? Well, there are a few things. Probably they've been through other traumatic events at their age. And also because as you get older, you learn to let things go. We'll talk about that, but that's important as well. So at the end of the day, we have to let those things go. And a little bit more into how it can affect us medically and mentally. So high blood pressure, high cholesterol, anxiety disorders, depression, all these things are happening because of stress. But a lot of adults, and what it says here is 67% reports that they don't feel like their problems are bad enough, then they shouldn't be stressed out because so many other people have it, much worse than they do. Each and every one of us has our own perception of what stress does to us and how stressful a certain event is. Someone else might not be as stressed out over something as the other person, but that does not mean that your problems aren't bad enough. Everybody that's experiencing stress that's affecting their day-to-day functioning should actually reach out and try to find ways to cope and incorporate new coping mechanisms into their day-to-day life. So some other symptoms, of course, is, like I mentioned, depression, sadness, frustration, sometimes like a shock, disbelief at certain things that are happening. How can this be happening to me? The inability to concentrate, the inability to focus, headaches, stomach problems, back pain. Some people use more negative coping skills to manage stress, and some of those are alcohol, drugs, smoking, eating, overeating, eating on the run, and that's not healthy either. So the only way and the most effective way to kind of approach, stress 101 is to look at this as a very holistic approach. What are we doing with our whole body, and what are we doing with all parts of our life so that we can address these things? So let's talk about some different methods. Thank you, Brittany. Stress relief techniques. I'm just going to have you read these real quick, and then we'll go each one by one. So being grateful for the positive things. A gratitude journal is something that a lot of different organizations, when we're focusing on mental health or the recovery process, we talk about using a gratitude journal or keeping a gratitude list. This is something you can do every day. You can do this in the evening after you come home, before you go to bed. You can always do it in the morning. Depends on, what kind of person are you. I like to get up, have a cup of coffee. I look at, my gratitude journal, and I like to watch the sunrise. It can give me a very much of a better perspective on my day ahead. And it gives me the opportunity to feel like, I can handle what's getting ready to come. Also, when you're focusing on, the good things, when there's other bad things happening around you, it kind of evens that out, and it lets you focus on what is good, what am I doing well, instead of just always focusing on what's going wrong. So that's just a different way and a different perspective to start thinking of things differently, which is very helpful. Next was, I believe, mindfulness and exercise, of course. Some people think about exercise and they're like, oh, I don't want to go to the gym. I don't have time. I have kids. I'm working. I have to go home. I have to cook dinner. Once when I first got to Florida Healthcare, I remember we were having a meeting of therapists and psychiatrists, and one of our colleagues said, all you have to do is maybe take a walk for 20 minutes. If you can do anything for 20 minutes, and that's all the exercise you really need. We don't need to, go to CrossFit every day, although some people love that, and that's great. But, just taking a walk around the block, even on your lunch break, doing little things. They don't have to be extraordinarily hard on your body, but just getting out and breathing and kind of redirecting your thoughts is a good way to get things moving. When I say mindfulness, I think most people think of meditation. And if you're like me, you probably go, oh, no, my brain just goes and goes. There's no way I'm going to be able to slow my thoughts down for that long. And I thought the same thing. But even again, if you can try these things, even if it's for a couple minutes, there's apps that you can download. YouTube has an array of, mindfulness exercises, a little meditation, guided meditation. Sometimes these can be 3 minutes. We're not asking for a lot of time, but as you'll see in a couple slides, we're going to do a breathing exercise together. And it only takes us a few minutes, but if you really focus, it can really change your perspective. And next we have, after the mind breath work and the body scan. So breath work, there's a lot to breath work. We're going to do an exercise, and they call that something different than I call it. I call it box breathing. If you know me, you know what that is. Your body scan is when we kind of check ourselves throughout the day. Because when we have a stressful situation, we sometimes carry a lot of that stress within our body. So, maybe you got a little tension in your neck. You start to feel, something behind your eyes. Maybe you're getting a little tightness in your chest. This is a time when you can kind of just lay down for a minute. Maybe just sit down for a minute and kind of just go over and see what's going on with your body, because your body's going to tell you what's wrong. The breath work, let's see if we can do this together. This is just a short exercise about breathing. When we breathe, we're going to breathe in very deeply and fill up our bellies and our whole body. So what we want to do when we're first taking a breath is we want to feel it all the way from our head, all the way to our toes. And then we want to hold that breath for about 7 seconds. And when we breathe out through our nose, we're really going to do that slowly, probably about 8 seconds. So let's try this together if everybody's ready. Here we go. And you know who you are. You better be doing that. Breathe in. Breathe out. One more time. Just practicing that exercise about 4 times can really help you before you go to bed. If you have trouble sleeping, doing a lot of these breathing exercises and mindfulness techniques before bed is going to really help you sleep. Also, turning off all those distractions, the TV, your phone, those things are also really important. And getting enough sleep and really watching your diet and having a very good, eating routine is actually even better for your stress and your body. So thank you for doing that. What do we got next? All right, here we go, the fun part. So aromatherapy, very therapeutic, very holistic. I think almost everyone probably is either bought a diffuser or gotten one for Christmas or great Mother's Day gift, FYI. Essential oils can be used in different ways. You can use them just with a diffuser and, you're actually smelling the oils. You can also use the oils topically on your skin, and you can also ingest them in different ways. You really do want to be careful of any type of oils that you're using. You need to go and make sure that you're talking to expert, do your research. We don't know, which ones are safe for which part of your body. Obviously, which ones that you ingest. Can you put a little lavender in your coffee? I mean, you actually can, but, go to one of the health food stores and talk to them about that, or do your own research. But they're important things. I know one question a lot of people have is about pet and essential oils. And I don't have a lot of answers to that, but I do know that it's something that you should probably ask your vet. That was mentioned to me after the last little presentation we did. So let's go with keep moving past the essential oils and the ways we can use them. So there's about a few here that are pretty popular. Lavender, of course. Lavender is very good for a very calming sensation, reduces anxiety. You can also use it for different things on your skin. Some people use oils for even perfume because that's just something that they enjoy and it keeps them, clarifying all day. Lemon is more of an antioxidant, anti-stress. There's sage, very popular, more of a stress relief, but an antidepressant in a way. Again, you're going to want to research and talk to your providers if you're going to use anything holistic. Jasmine lifts the mood, improves sleep. I do have a different white noise and diffuser that I do use sometimes that I keep on my nightstand, and it does help me sleep better. Chamomile, that's more anxiety and stress, but also if you ever had chamomile tea, it's very, they say that it can really get rid of those aches and pains. The lang lang, stress, anxiety, tension, and then orange. It's calming, but I've put orange in a diffuser and it kind of gives me that a brightness, sort of like sunshine. So I don't know if that's all calming, but I also like it. So the best thing about all of the things that, we're talking about today is that you can kind of decide what works best for you. You can put them all in your toolbox. What I would do is keep a journal, maybe for a week before you try to incorporate a lot of new things. When we try to incorporate all these new things, one of the things that happens is we don't stay committed because it's new, and after a while we just stop doing it. But if you keep a journal and you write down at the end of the day, when was I stressed? Was that on my way to work? Was it in the morning when I was trying to get ready? Was it during the day when I had, some interactions with, other people? Was it at night when I just knew that I was tired and I had to come home and I still had a lot to do for my family? Try to identify, what is causing the stress, and then what works for you. Are you someone that is willing to go and take a walk after dinner? Do you want to go take a walk on the beach? Do you want to try yoga? Of course, I'm going to, give the shout out for yoga, which I found a few years ago. It's done an amazing, amazing thing for me. I'm not one to, jump in and do all this hot yoga, but I definitely am someone that likes to incorporate the breath, with movement. And that really is what yoga is about. And so even for 20 minutes a day, a little YouTube video, you can do it yourself at home with a yoga mat. You don't have to spend a lot of money to go to, I don't know, a gym or, another place to do that. So write some things down, think about what we talked about, and then see what works best for you and try to implement them into your day-to-day life. Get a partner, try to get somebody to do it with you. If you have a friend, it's always good to have an accountability partner. It keeps us moving. So I think we're going to take some questions at this time, and then I can talk a little more about behavioral health for a minute before we end.
Thank you, Heather. So if anyone has any questions, please feel free to put those questions in the chat bar, or you can unmute yourself and ask Heather directly if you're interested in that. I know a question that we had prior was, parentals kind of have a little bit more stress because they're caring for their child, and, you have to fit all these things in a day. So I guess I'll ask, Heather, do you have any suggestions on our parents in the meeting?
Yes, that was a question. So, what I did say about that is, moms and dads need to have a timeout for themselves sometimes. There's no shame in saying, I need a minute, go to the bathroom, take some breaths. We always want to, project our good parenting skills. If we're not taking care of ourselves, we may come off as a little frustrated. And at times we're not giving all that we can. So it's okay to take time for yourself. If you don't have time because you're so busy and you're working and you don't have a partner, and even if you're a single parent, when your kids go to bed, I want you to take a bath and I want you to put bubbles in it and I want you to read a book. Make that time. If there's things that you can do with the children instead of, watching TV or playing video games, go outside, take walks, go to the beach, walk around the neighborhood, take a bike ride, catch bugs, catch lizards. I do it all the time with my grandson and we have a blast. So yes, parents need extra care.
Thank you for that. I think that is great that you share that, because it really does hit two stones at once. You're taking care of yourself, reducing your stress, and also putting that exercise into your routine. And for the kiddies too, spending time with the kids as well. So that is awesome. But it looks like we don't have any further questions here. We can move on to talking about our behavioral health services.
So, behavioral health. Don't be scared. Behavioral health is super important. Even all of our behavioral health staff, I encourage them to have their own counselors because self-care is important. And if we don't model that behavior, we cannot teach that behavior. And that's not always the case. When I was younger, I did not really grasp that for a while. I thought I was invincible. But now there's no shame in the game. So behavioral health, we offer psychiatric services, which is medication management, not therapy. But if you are interested in talking with someone about, your symptoms and wondering if medications might be something that you need, we have those services available for you. You can get a referral from your primary care physician. If you're in a crisis situation, we have a crisis team and you can access us 24/7 and we can get you in to our behavioral health department sooner than probably a referral. We also have therapists that are specialized in a lot of different areas. We have some play therapy, children's therapists. We have therapists that are doing EMDR certifications. We have therapists that are working in trauma. We have substance abuse therapists. We have groups 5 days a week. We have substance abuse groups. We have life skills. We have women's groups. And we even have a mindfulness group that is accessible through telehealth. And most of our groups are accessible through telehealth and in person. So if you need more information about that, feel free to, get a hold of our department. You can ask for me directly. I can get you those, links. We also have a substance abuse program with addiction specialists, and we offer medication-assisted therapy. As you know, we are in the middle of an epidemic with opioids and fentanyl, and our county is the highest for overdose right now. Per capita, we take that very seriously, and we partner and work with community resources to offer different types of services, peer support. So we kind of do a little bit of everything in our behavioral health department. And we all believe that, helping each other and giving to our patients is something that's very important to us. And we want our community to be healthy. So please feel free to reach out to us.
Awesome. Thank you so much. First of all, thank you, Heather, for being our presenter and our speaking, sharing your insight and your expertise on stress management. Thank you to all of our participants today. We appreciate you coming on to the webinar. I hope you enjoyed it and learned something today. If you have any other questions, please feel free to reach out to us at the email on the screen, wellness@fhcp.com. We also have an overview, just like a 1 to 2 page overview of this presentation. So if you're interested in receiving that, it will talk about all the tools and techniques that you can add to your box. You can email us as well, and we'll send that to you right away. All right. Have a good one, everyone. We'll see you soon. Okay.
Bye.
Bye.